Good afternoon, everyone, and thank you for joining the MVMA for its 8th installment of the COVID-19 webinar updates. For those of you who don't recognize my voice, I'm Nicole Cass, the CE Program Manager for the MVMA, and today's moderator. A quick reminder before we get started, if you do have any questions, please type them in the Q&A area. The box for the Q&A can be found at the bottom of your WebEx screen by clicking on the black circle that has 3 dots and choose Q&A. I will hold all questions until the end of today's session. Today, we are fortunate to have joining us Dr. John Howe. Dr. Howe is currently the president of the MVMA. I know many of you are familiar with him, but for those of you who don't know, he is a 1977 graduate of the University of Minnesota's College of Veterinary Medicine. After graduation, he started a solo mixed practice in North Branch, Minnesota. And in 1984, he sold the practice and moved to Grand Rapids, Minnesota. There he established North Country Veterinary Clinic, a mixed animal practice. Dr. Howe has since sold that practice. Between the years of 1992 and 1999, he served 2 governor-appointed terms on the Minnesota Board of Animal Health and was the president of the board from 1996 to 1999. He is the past member of the Minnesota Veterinary Reserve Corps Advisory Group. He is the past secretary, treasurer, and president of the Arrowhead Veterinary Medical Association. Dr. Howe has served as an executive board member and the vice president of the MVMA, and in 2007, he was our president. He received the Minnesota Veterinary Medical Association's Veterinarian of the Year Award in 2011 and the Distinguished Veterinary Service Award in 2015. Go ahead, Dr. Howe.
Thank you, Nicole. Well, hello, friends, colleagues, and fellow Minnesotans. I truly hope today finds that you and your loved ones are doing well. It's great to be with you, even if we must gather remotely, in what has become for so many of us a virtual world when it comes to communicating with one another. I see we finally got some good news from the governor the other day on Tuesday that starting on May 11th, we can finally start to do some elective procedures and surgeries. And so that's a good bit of news, even though you still have to have a written document to implement, an internal oversight structure and all those things, and complying with all kinds of rules. And I know it's going to be difficult, especially if if you have a very small waiting room and you have several doctors. It's going to be hard to have enough clients in there staying far enough apart. So there's going to be a few obstacles to overcome, but at least it's a start in this process. These truly are unprecedented times, and for you and the AVMA, much like Minnesota, has taken unprecedented action to help continue to serve our members and to meet their needs. We all remain in the grips of this COVID-19 pandemic, and I want to reassure you that the AVMA is working around the clock to develop guidance, resources, and information to support our members and the entire veterinary profession. We are working to help folks understand how the disease is impacting veterinary teams and patients, as well as how the profession is adapting and continuing to operate in this environment. Each of us has been impacted by COVID-19. We have had to adjust our approaches to serving our customers, our clients, and patients. Some of us are working with limited resources and supplies, but we are working together to do what is right for our communities. And I'm proud to call Minnesota home during these trying times. So many of you have stepped up and contributed in countless ways to assist. You are part of an essential workforce, and for that, we thank you. You have donated personal protective equipment. You have provided your services to those who need it most. You have helped people understand the virus so that they are empowered to care for their animals and their pets. We are seeing an increase in the use of telemedicine, which is a good thing. We are also seeing increased cooperation and collaboration with our human medical colleagues. These are incredible examples of dedicated people doing great things during what are tough times. Thank you all so much for your tireless work, for your generosity and support, and for every veterinary professional's unwavering commitment to your patients and clients, your colleagues and communities. Our members recently received notification that the AVMA Board of Directors made the difficult decision to cancel our annual convention based on the threat to the health and safety of all attendees. We're deeply concerned and care about our attendees, partners, vendors, and all those who join us each year, and we do not believe there is a way to ensure their health and safety at this year's convention in San Diego. We are a science-based One Health organization, and the science tells us that we will be unable to have a safe event by the end of July. These are not easy decisions, and we are all working to create the best possible outcomes for all. While we're disappointed to not have a live convention, we are exploring virtual conference options as an alternative meeting. We are also looking forward to AVMA convention returning in 2021 in Minneapolis stronger than ever. And I'm certainly looking forward to being there and seeing all of you where we can showcase our good city and welcome each other with some real Minnesota hospitality. Next slide. The AVMA's work to identify and develop the best possible guidance and resources for our members is made possible through our ongoing collaboration with U.S. federal agencies, including the CDC, the FDA, the Department of Agriculture, the Department of Homeland Security, and global organizations like the World Organization for Animal Health and the World Health Organization. We are also tapping into expertise from veterinarians and others working in infectious disease, public health, zoonotic disease, monitoring, and disaster response. And we have been working with state veterinary medical associations, species-specific organizations, and veterinary specialty organizations. We also regularly communicate with the Association of American Veterinary Medical Colleges, the Student AVMA, and veterinary schools, as well as the American Association of Veterinary State Boards, continuing education providers, and other colleagues across the healthcare system. Next slide. Our volunteer leadership and staff are gathering, interpreting, and sharing breaking news and developments. New resources are developed, updated, and shared almost daily to help veterinary professionals navigate COVID-19. Our member emails, AVMA at Work, blog posts, social media communications, JAVMA articles, media outreach efforts, and on-demand webinars on AVMA Axon are all designed to support and help our veterinary colleagues during these challenging times. Slide 4. Our dedicated COVID-19 website, avma.org coronavirus, is enhanced regularly with tangible, practical resources and helpful updates as new information becomes available. Among its features are practice resources, legislative and relief program information, including federal student loan guidance, business and economic insights, and well-being resources, all newly developed and specific to COVID-19. For instance, a section of the website is devoted to how to keep your veterinary team as safe as possible during the pandemic. Guidance includes a veterinary case management flowchart that provides practical guidance on managing cases at the clinic while minimizing COVID-19 exposure through social distancing. You will also find AVMA guidelines for using and conserving PPE, along with recommendations specific to animal shelters, equine practice, food animal practice, and house call or mobile practices. Other resources through the COVID-19 website include a client handout to help pet owners protect animals by planning for their care, advice on maintaining emotional well-being, social media tools for sharing with your clients, tools to help your small business, and several Axon on-demand webinars focused on COVID-19. Slide 5. A topic on the minds of many is the testing of animals for COVID-19. We have added new resources in our practice resources patient care section of the website. The AVMA created an algorithm, a partial image of which you see here, to support veterinarians in making decisions regarding animal testing for SARS-CoV-2. We also have published answers to frequently asked questions about animal testing made available from the USDA, CDC, and the AVMA. Different states may also have different requirements for testing and collaborating with and reporting to public health and animal health officials. The AVMA has provided links to this information when available from the state in its state orders spreadsheet on our webpage. Routine testing of animals for COVID-19 is not recommended by the AVMA, CDC, USDA, American Association of Veterinary Laboratory Diagnosticians, the National Association of State Public Health Veterinarians, or the National Assembly of State Animal Health Officials. But we all know that because of the situation always ever evolving, public and animal health officials may decide to test certain animals. In the United States, the decision to test should be made collaboratively between the attending veterinarian and local, state, and/or federal public health and animal health officials. Discussion among key regulatory authorities and animal health experts indicates that testing may be justified for certain animals if, for example, the animal has clinical signs consistent with SARS-CoV-2, more common causes of the patient's clinical signs have been ruled out, and the animal has a history of close contact with a person or suspected or confirmed COVID-19, or the animal has been exposed to a known high-risk environment where a human outbreak occurred, such as a residence, facilities such as nursing homes or prisons, or a cruise ship. You can find other scenarios where testing may be warranted on our website. Slide 6. As Dr. Kent McClure, our Chief Advocacy Officer, recently shared with you on a previous Lunch and Learn, the AVMA is actively engaged with authorities at every level of government to address veterinarians' needs as we grapple with COVID-19. We advocate for programs that support veterinarians, their teams, and the operation and viability of their small businesses. The AVMA actively advocated for the designation of veterinary medicine as an essential part of the country's critical infrastructure and for federal relief programs that support the economic viability of veterinary practices and the profession as part of the stimulus packages recently passed by Congress. Our nation recognizes the value that veterinarians deliver, and we remain committed to strong advocacy on behalf of the profession. By standing together, there is no question in my mind that we will come out of this pandemic stronger than before as individuals and as communities. Slide 7. Speaking of communities, I want to share some insights into what our international friends are experiencing. And I hear from a lot of my colleagues in Australia, several who are in the military in Australia or retired in the military, as they're also assisting in the pandemic. The AVMA has been in contact with international colleagues to share resources and gather information regarding how the veterinary profession is faring in their regions. We are in regular contact with the Canadian VMA, the Federation of Veterinarians of Europe, and the French and Italian veterinary associations. We are also sharing resources with the British Veterinary Association and the World Small Animal Veterinary Association. And we have been in contact with the City University of Hong Kong Veterinary School, particularly when the first dog in Hong Kong was tested positive with COVID-19, even though that dog really didn't have any clinical signs, and almost none of the dogs have had any clinical signs. And as far as that pug in North Carolina, you know, that the pediatrician and her husband, they had 3 people in their family that were positive. The daughter was not, the other dog was not, and the cat was not. But the pug, you know, had some mild sneezing, missed a breakfast, and I'm sure, as all of you can attest with me, anybody that's had a pug in the office, they're usually sneezing or exhibiting some signs of mild respiratory symptoms. Well, what is happening in other countries is very similar to what is happening here. We liken what is happening in the EU, for example, to what is happening in the US. The veterinary profession across the developed world is dealing with very similar issues to what we are dealing with. This isn't a US specific thing. Many foreign veterinary associations and regulatory boards have advocated for veterinary medicine to be considered an essential business by local and national governments. The World Veterinary Association and the World Organization for Animal Health published a joint statement advocating for veterinarians as essential business status. The Federation of Veterinarians of Europe and the World Small Animal Veterinary Association also have statements posted on their websites, as do the Italian, British, French, and Spanish veterinary associations and/or regulatory bodies. However, services provided by veterinarians in some countries may not all be equally essential. In some cases, categorization of specific procedures as essential or non-essential has led to differences of opinion between veterinary associations in any given country or between the association and the regulatory body. Essential services always include those associated with food safety and security, public health, and urgent or emergent medical and surgical procedures. However, even services related to food safety and public health can be recategorized from essential to non-essential. For example, on March 26th, the Italian government suspended all animal health-related epidemiological surveillance activities except those related to African swine fever and highly pathogenic avian influenza. Human medical needs for personal protective priority over medical needs. But we still know that PPE is still needed at veterinary clinics to help prevent spread of COVID-19 and protect animal and veterinary health during certain procedures. European veterinary associations and regulatory bodies have been continually developing and updating resources to assist their member veterinarians in determining how best to protect their animal health care teams and their clients while preserving PPE and still providing essential medical and surgical services for their animal patients. The National Federation of Italian Veterinary Orders, which is the regulatory body for veterinary medicine in Italy, is one association that has stepped up to assist Italian veterinarians during the crisis. The Federation has responded to multiple government decrees that were enacted since February to help control the devastating COVID-19 epidemic that swept that nation by providing guidance to Italian veterinarians on allowed movements and procedures, as well as government-funded compensation for employees required to take leave for health or business reasons during the pandemic. In Italy, each veterinary clinic that stays open must guarantee that all measures designed to prevent spread of COVID-19 are in place. As recommended by the Italian Federation, common measures taken by Italian veterinarians included use of face masks and gloves, maintaining a 2-meter distance between clients and staff, screening clients at the reception area, washing hands, keeping a disinfectant dispenser in each room and on the waiting room, and reminding clients and staff to use these dispensers often, and triaging clients and patients outside the clinic and or by phone. And it sounds like what we've been doing everywhere, doesn't it? Same is true on farms. All biosecurity measures and use of appropriate PPE have been implemented, but the shortage of disposable materials has had a significant impact on large and food animal veterinarians, especially in Lombardia, the worst COVID-19 cluster area, which is also the most important area for animal agriculture in Italy. Veterinarians working in Italian slaughterhouses and in food inspection are essential government employees under public services, and for the most part are continuing to work as normal. Thus far, these veterinarians have had access to sufficient PPE. Many Italian veterinary clinics have struggled, though, during the country's crisis. And while Italy is now undergoing a gradual easing of its COVID-19 lockdown, the government is continuing to strictly enforce continued social distancing, even as other restrictions were lifted. CM Research, through Vets Panel, is conducting an ongoing survey to address the impact of COVID-19 on companion animal and veterinary professionals and their practices in numerous regions. Initiated on March 13th, the survey is being repeated every 2 to 3 weeks for as long as the COVID-19 outbreak continues. Respondents include a mix of owners and partners at companion animal practices, from small and large independently and corporate-owned practices across 5 European countries, the USA, and Australia. And the results are available on the Vets Panel website at vetspanel.com. You can learn more about AVMA's international impacts at avma.org/coronavirus in the Practice Resources International Experiences section. It's a great website, and you really need, if you haven't been on it, you should go on there and see all the things that are available to you. Slide 8. Switching gears a bit, I'd like to spend a few minutes on AVMA's efforts related to our media outreach. These efforts, particularly during these times, are critical to our goals of not only promoting the expertise and knowledge of veterinarians, but helping educate the public. We got started early, way back in February, positioning the AVMA as a scientifically authoritative source on COVID-19. Since then, and through April, we have tracked nearly 3,000 mentions of the AVMA and COVID-19 in the media, with a total reach of more than 5 billion impressions. Impressions, broadly defined, are any interaction with a piece of content and an audience member. For example, if you read the front page of the New York Times, every article on that page counts your viewing as one impression. I must say that I've had quite the media run, conducting dozens of interviews over the phone, by Skype or Zoom. Some of our higher profile media placements include CNN, ABC News, Fox News, Good Morning America, The Today Show, The Washington Post, The New York Times, The Wall Street Journal, USA Today, Associated Press, Reuters, Martha Stewart Living, Time, and People Magazine, and The Progressive Farmer. You might have even caught me on early morning TV right here in WCCO in Minnesota. We have made a significant impact due to these efforts, and we're being viewed as a trusted source of information during this crisis. You know, one thing that has bothered me on some of the TV that I watch, because it's stock watch, everything is COVID-19. When I see MDs talking about animal health and the problems, then when they call me, I've let them know that, I don't talk about child health, so maybe they shouldn't be talking about animal health. And that's had an impact. I've had producers call me and say, you know what, you're right, we'll use you guys more. One area of growing interest with the media is the unfortunate need to euthanize food animals. And this is a huge thing in Minnesota. I was on a webinar last week, I believe it was, with some swine producers about what's going on here with swine production. But the need to euthanize food animals due to the supply chain and workforce issues. And we've seen it right here in Minnesota. We expect that more of these situations are going to arise. This is really difficult for farmers. It's hard on veterinarians, it's hard on communities, and it's hard on society. But in times like this, such actions may be necessary. Many media outlets and producers are citing the AVMA's guidelines for the depopulation of animals, which lists several methods of depopulation that may be considered in emergency situations such as this. While we cannot guarantee that our guidelines are being applied in any given situation, we work hard to make them available in these types of situations. We all know that these are difficult decisions to make. That's why our guidelines stress that depopulation is not to be deployed under ordinary circumstances. It's only to be used during times of emergency. While these situations are unfortunate, we understand the need for guidance to those who are charged with ensuring that depopulation is handled correctly and that it is done in the best interest of the animals and the people who are caring for them. Slide 9. The importance of well-being. I'd like to conclude part of my portion here of the Lunch and Learn by focusing on two very important and oftentimes interrelated topics: well-being and financial health. Our daily lives have looked a lot differently lately. Over the past few months, we've all been asked to make significant changes to our professional and our personal lives. From adapting to a a new work environment to changing the way we shop at the grocery store, all while engaging in social distancing. These disruptions have affected us in ways both big and small. Canceled events, and boy, I can relate to that. I had so many travel plans. I was going to so many states all over the world, and boom, it just stopped. So canceled events and resource insecurity, as well as implementation and easing of mandatory lockdowns, it can affect our mental health and our well-being. In an effort to help protect and maintain member well-being during the COVID-19 pandemic, the AVMA is trying to remind and encourage colleagues that in times like these, we are likely experiencing a mix of emotions, which is perfectly okay. Emotions are part of the human experience. We are supposed to have feelings, and feelings aren't good or bad. They may simply be more or less comfortable. What matters most is how we choose to respond. And the AVMA has developed resources and tools to support veterinarians' personal well-being in this time of uncertainty. All of these resources can be found on our coronavirus webpage, as well as our dedicated well-being site at avma.org/wellbeing. Slide 10. Studies show that financial wellness is an essential component of overall well-being. We know that the COVID-19 pandemic has caused economic repercussions worldwide and that it is impacting small businesses, including veterinary practices and individual practices. I've talked to so many veterinarians, practice owners, and partners that have said their business is down 50%. That is huge. That's been a long time too at that state. As part of our commitment to supporting the veterinary community through this crisis, the AVMA has added a business and economics section to the COVID-19 webpage that contains resources to help practices adapt, survive, and even thrive in the wake of immediate economic downturn. We are also applying our economic expertise and research to understand the impact of COVID-19 on our economy and what it means to veterinary practices as small businesses. Large-scale shelter-in-place orders, travel restrictions, and social distancing measures have resulted in a sharp fall in consumer business spending. We can anticipate these patterns will continue at least into the near future. It's hard to predict how long the downturn is going to last, but there's reason to be optimistic about the eventual recovery. A recent Harvard Business Review article that you can find on our website has some good advice for us all, including don't become dependent on projections alone and recognize that financial markets are currently reflecting great uncertainty. Number 2, explore a wide range of scenarios in your business planning and understand what the worst case scenario looks like. 3, begin to look at past crisis. Look past the crisis because we will get through this and we'll recover. And assess what opportunities or challenges will arise. And ask yourself how you would lead in the post-crisis world and be part of a better and faster adoption of innovation and new technologies to make your practice better. An extraordinary situation is occurring in the fabric of our profession, our economy, and daily lives. No practice, pet, or person has been untouched by COVID-19, by the pandemic. Yet there is a lot of reason for hope and optimism about recovery and eventual return to normalcy. When that happens, it'll be a new normal with new lessons and a refreshed understanding of what it means to survive and thrive as a veterinarian. Slide 11. Finally, I want to share with you some new interactive maps that we've developed. These maps present different lenses to view the COVID-19 outbreak and its impact on veterinary medicine and veterinary professionals. They're interactive, allowing users to zoom in and out to hide or show specific data layers when more than one variable is shown. Practices can use the data to make informed and strategic decisions during the COVID-19 pandemic that best support the delivery of critical services to patients and clients while keeping veterinary teams safe. Map 1, the COVID-19 cases. It shows Current COVID-19 cases at the county level. It's updated twice a day with data from Johns Hopkins University. Larger red dots indicate a higher number of confirmed cases. You can zoom in to see the total number of cases and deaths in each county. Map 2, veterinary practices and COVID-19, allow you to view the density of veterinary practices at the county level. Darker shades of blue indicate more practices in that area. When you click on a county, you can see the total population and the number of veterinary practices in that county. By moving the slider across the map, you can view COVID-19 cases and veterinary practices. As you know, counties that have a higher density of veterinary practices present more options for veterinary clients. That's why maintaining a strong relationship with clients is one way to set your practice apart. In areas that are heavily impacted by COVID-19, nurturing the veterinary client-patient relationship is especially important. Map 3, social vulnerability in COVID-19, provides a window to assess how your area may be impacted by COVID-19. If your practice is in a high vulnerability area, your clients may be at an economic and/or health disadvantage and more likely to be impacted by the pandemic. Slide 12. I shared a lot of information with you today, and I thank you for your time and attention. I know it's hard to listen to all of this sometimes, but while these are challenging times for all of us, together and our community is much to eat. I hope that you, your loved ones, and your colleagues continue to stay healthy and safe. I'm happy to open it up for any questions.
A reminder, if you do have any questions, please type them in the Q&A area. I don't currently have any, but it takes people just a second to type them in. So I do want to thank you, Dr. Howe, so much for all of your time today, and a thank you to your coworker, Mr. Kirkpatrick, for helping me organize this with you. We greatly appreciate the AVMA and all that you are doing on behalf of veterinarians around the country. So thank you. Are there any questions for Dr. Howe? I do have a question. Hang on just a second. It's kind of, was the distribution of veterinarians per county based on AVMA membership or another information source?
You know, that I'm not sure of. I could look into that, but I don't have that information available to me at the moment.
Okay, I'll follow up with someone in your office and we'll get that information to, it was
Sure.
Dr. Wilson who asked that question.
Sure.
Another question is, will the AVMA be releasing an I can't quite tell what, I think it has a typo, oversight document?
In regards to, I think we have.
Waiting to see if she's going to type something back to me. Dr. Bergen, was there something in particular you were looking for? I know a lot of questions that veterinarians have, especially when we were more not allowed to do procedures. Oh, she was in regards to opening up a clinic once the restrictions have been lifted.
So that opening up clinics, yeah, that's pretty much going to be state by state.
Yeah. Okay. Yeah. So they'll be looking to us and not you for that.
Probably,
Sure.
but we probably have a lot of information on our website about that.
Great. So if you'd like to look that up on their website, but once things do get lifted, I know that Dr. Boyle has been working hard to try and get information out to everyone and some documents on how we should safely open back up. So
Yes.
in the future, once things, well, I don't know if anything will go back to the way it was before, but
I hope so. I certainly hope so.
Yeah, I do too, but
I'm optimistic.
yes. Let's see, what are the risks to us if we handle pets from an infected household since the fur would have the virus on it?
You know, that's a great question, and I get asked that by the media all the time. And because pet fur, cat and dog hair, is very porous, it tends to trap the virus. So there's have not been any documented cases worldwide of people getting COVID-19 from their pets. So that's a good thing. The virus is, stable on smooth surfaces. We know that, like countertops and doorknobs, but it gets trapped in the hair. But we've always warned people, in the media, if you're walking your dog, don't let it go up to a stranger and let that stranger pet your dog. I mean, if the stranger actively coughed or sneezed on your dog that had COVID-19, most of that virus should still be trapped and dried before you got your dog back home. But in that case, I think I'd still, I'd probably give my dog a bath in chlorhexidine scrub. To be safe.
Thank you. Yes. Does the AVMA have any information pertaining to veterinary practices where there's been an intra-clinic transmissions?
There have been some of those, of course, and those are governed pretty much by there's CDC recommendations and everything else. And then every state has different recommendations, but there's been very few of that I know of, very few in-clinic transmissions.
Thank you. And Dr. Gaskin says that we have great leadership here at the MVMA and AVMA, so thanks to all of us.
Thank you. Yes, we are. Minnesota is very blessed, I think, to have great leadership.
At this time, I am not seeing any other questions. I'll give it just a second in case there is someone still typing. Okay, I'm not seeing any more. So again, Dr. Howe, thank you so much for your time today. And we hope to see you in the near future at the next MVMA annual meeting in February. If we can have it, let's hope so.
And if anybody would like to contact me, go ahead if you want to send me an email or you have questions about anything at any time. So
great. Thank you very much for that offer. Everybody have a great day and stay safe.